Hi, Tabitha Butcher here doing a video on disseminated intravascular coagulation. DIC is not an actual disease but an underlying condition of septic shock. Some background what septic shock is: it's a potentially fatal condition that occurs when sepsis leads to life threatening low blood pressure, and sepsis develops because the body just has an overwhelming response to an infection. So, a complication of septic shock is DIC. So, this is when thousands of small clots form with an organ capillary, so like the liver, kidney, heart, brain, creating hypoxia and an anaerobic metabolism. So, what are the signs and symptoms of disseminated intravascular coagulation? So, typically, what you'll see at first are bruises, which is ecchymosis, is the medical term. And you'll see that a lot just because it's right on the skin. So, the first thing you're going to be doing is inspection. So, you'll see bruises on that patient. Also, some bleeding, like petechia. Coagulation times, and which is the prothrombin time, is going to be prolonged. Also, bleeding from mucous membranes, venipuncture sites, and the GI and urinary tracts. You'll notice some blood in, so patients will complain of blood being in their stool or urine. And also a decline in organ function, because once you have developed sepsis enough that you're in shock and you have DIC, you're going to start potentially seeing some organs shut down. So, what are three risk factors for DIC? So, some risk factors you'll typically see are acute kidney injuries, of course, sepsis, trauma, cancer, any type of shock, abruptio placentae in pregnant women, toxins, and allergic reactions. So, those are all risk factors. And 2/3 of cases that are of DIC are caused by an infection or malignancy. So, majority of the time, you're going to see this being caused by sepsis. What are some expected laboratory factors? So, you'll see a prolonged PT or thrombin time. So, that's when the patient comes in and you're checking to see how thin their blood is. And elevated fibrin degradation products and D-dimers. What are 5 nursing interventions for managing and medications used to manage DIC? So, nursing interventions and medications can kind of depend on the underlying cause, because, again, it's not a disease in itself, it's a complication of a disease. So, first and foremost, you're going to be correcting the secondary effects of just whatever the underlying treatment is. So, that's what we're going to mainly focus on. But then the secondary effects of tissue ischemia by improving oxygenation. We want to make sure we're replacing fluids, which would be correcting electrolyte imbalances, administering vasopressor medications, replacing depleted coagulation factors and platelets. We're going to be usually giving heparin infusions, which is actually a controversial treatment, it is said, but in rare cases they will use a heparin treatment. So then, what are some nursing interventions? So, we would assess thoroughly and frequently for the signs and symptoms of disseminated intravascular coagulation. We're going to look at lab values and monitor them frequently, because once we're at this stage, you, again, can possibly have organ failure and some other things. So, we want to make sure we're watching those labs. Monitor vital signs closely and include neurological checks in with your vital signs. Avoid medications that interfere with platelet function. Avoid rectal probes or medications, just because, again, you have that increased risk of bleeding, so you don't want to injure anything there. Avoid intramuscular injections. Monitor the amount of external bleeding. So, like for women, if they have vaginal bleeding, you want to just monitor like the pad counts. Use low pressure with any suctioning and administer oral hygiene carefully. You don't want to, be rough because you're going to cause them to bleed. So, what's the prognosis for DIC? The mortality rate can exceed 80% in patients who develop severe DIC. And again, this is usually going to be related to severe sepsis, septic shock, just that extreme infection that's going on with the body. The primary prognostic factor is the ability to treat the underlying condition that precipitated DIC. So whatever this patient has going on that then caused this complication, that's what you're going to be looking at treating. So it can be multiple different factors, but again, it can exceed up to 80%, which is not good in patients. This is to the point where they have something very life-threatening, very severe going on. So you want to make sure you're monitoring your patients very closely, documenting things very accurately, and, checking your medications, everything, and just giving good report to other nurses and the provider. And that is all for our disseminated intravascular coagulation.